Welcome everybody to our Dementia Toolkit video series, a one-stop shop answering all your questions on everything dementia related. Simple educational advice from people with lived experience and professionals in their field. We aim to provide support that's personalised to help you on your dementia journey. Who are Disability Cornwall and how can they help?
I'm Jane Johnson and I am the Chief Executive with Disability Cornwall and Isles of Scilly, a wonderful social enterprise and disabled people's organisation. I've been in my role about 23 years I think now. We're a fantastic organisation with the most incredible people involved. We're very fortunate in that. We have a wonderful board that comprises a majority of disabled people, and 65% of our workforce are people with a long-term health condition or disability, or we're carers, or we are parent carers of disabled children. So Disability Cornwall has a variety of services which we deliver as direct services, and we work in partnership with organisations and across all sectors. We are a core part of the Cornwall Disability Alliance, where we work with all 10 of Cornwall's disability organisations, and in a very similar way the Lived Experience Partnership, which works with nearly 20 organisations of people living with lived experience from various communities across Cornwall. And I'd say in a nutshell we support over 20,000 people directly per year with advice, practical support or engagement in our activities. But we're not a service delivery organisation. It's not what we exist to do. We're here to underpin the rights and entitlements of our stakeholders. We are about equality, and we are about our lived experience voice, and we work towards shaping a system that is inclusive, accessible for all of our people, so we can all live with dignity, have autonomy over our lives, and live well and inclusively in our communities. One of our longest standing services is our Disability Information and Advice Line. And it's a fantastic service that supports thousands of people every year, and it is the front line of our organisation. There are 7 key areas of support that Dial can provide. I can't list them all off now, but I can tell you that they enabled our clients to enhance their household income by over £2 million in the last financial year. They also support people with grants and independent living equipment, their rights around housing and health, and it's a wonderful service. It's also a third-party reporting centre for hate crime, and there's various other things within it. The PAMAS service is fantastic. So where people choose to manage their own care and support, and they can employ people and to help them with that, which is a fantastic model, because for many years people have opted for traditional models of care, which doesn't necessarily meet everybody's needs, because what do we all want when we need care? We want to get out in our communities. We want to live the life we've always lived before. We don't want to stop doing things just because we've acquired a health condition or a disability. So we encourage people to choose an option for care that enables them to have a direct payment and manage their own funds so they can employ staff. So essentially what PAMAS does is it does the monthly payroll, it manages people's money, and I think in total it manages over £9 million a year of local authority and NHS funding. We hold it for people, we pay their bills, we do what's needed to do so they can just focus on living their life. Humans Cornwall is a wonderful provision that we started during the pandemic, when we started to look at the barriers for people returning home from hospital. And what we saw really surprised us, and actually so many of our people live alone as well. And going home from hospital when you've had a bit of a stay, and it's the same for any of us, you go home, your house is in a bit of a mess, the bin's full, you know, you might have had an accident before you went in, the heating might have gone off because you've not been there for a while. Well, we go in to help make sure all those things are right for people. So they're stable, they're warm, they're comfortable, get some shopping in and start to take them on the next phase of that journey if that's what they need. Some people, that's all they need, just that at home. But we can help with absolutely anything at that point, but it's about stabilising and wrapping support around people, and I think that's what Humans is absolutely fantastic at doing. We have a variety of other services. We have our Young Advocacy Fellows, who are a wonderful group of young adults who do some great work to amplify the voices of young people. We are a partner in the Cornwall Carers Service, so we deliver the Carers Advice Line, which is a wonderful service, open 5 days a week and late to evenings, and we can help carers with all kinds of things, whether it's just direct questions, respite, grants, again, carers entitlements, anything at all that's a carer related inquiry, that service is there for them. And what is wonderful about that service is it's mostly staffed by carers themselves as well. So they very much understand the lived experience of carers.